afternoon, Dr. Jagis. I'm Sricharan Pusala, Executive Council President-elect for HOSA-Future Health Professionals. Today, I'm delighted to host HOSA's Executive Interview Series. This series is designed to deliver high-level industry insights to the HOSA classroom and invaluable mentoring advice for college, career, and life path exploration. To learn more about the series, upcoming guests, and how you can participate in future interviews, please visit HOSA.org. To keep up with HOSA online, be sure to follow HOSA and our Executive Council officers on social media. Today, we'll be talking about emergency medicine. While it's one of the most recognized specialties in medicine, the ongoing pandemic has certainly catapulted it to the forefront of healthcare in the diagnosing and treating of COVID-19 patients. I'm honored to speak with one of the most respected leaders in emergency medicine, Dr. William Jagis, President of the American College of Emergency Physicians. Thank you for taking the time to do this, Dr. Jagis. Without further ado, let's get started with our first question. Dr. Jagis, will you take a moment to explain what emergency medicine is and why it's so important to healthcare delivery?
Emergency medicine essentially is the medicine that is delivered when you go to an emergency department or when you have an emergency and access that care prior to coming to an emergency department broadly. For emergency physicians, our specialty is probably about 50 years old and has the requisite training in emergency medicine to go along with that history. And essentially, it is the ability to see patients with an acute need that is essentially unscheduled when they are looking for care that they feel needs that immediate attention. And you probably are most familiar by going to an emergency department to see us in our specialty.
That makes a lot of sense. I mean, it's a lot of high intensity and very on the spot kind of medicine, right? It's a lot less routine, I guess.
Especially now, I think the more we see now in our communities, people have places to go elsewhere for some of the lower acuity care, whether it's a urgent care center or extended physician hours or telehealth or any of those things. A lot of those lower acuity, acute needs have gone to those areas, and we are seeing, yes, a higher acuity in our departments at this point.
And you've worked in several different roles within emergency medicine before your current roles at ACEP and Alliance. Can you walk us through your career path and what kind of drew you into emergency medicine?
I guess you start with going into medicine in general, right? I went into medicine because my father was a family physician, and he was not the kind of physician who said, you should do this. He was the kind of person who said, you should do what you love. As I observed him doing what he loved, it became something that I decided to pursue into college. So I had to go and start all those pre-med courses right in my junior year, but was able to do that. As I got through medical school and started to look at the different areas of medicine that I liked, I didn't really find one that overwhelmed me, but a bunch of things that I liked about a bunch of different parts of medicine. And to be honest, like most of us, that adrenaline push of those high acuity needs was good for me as well. And so it was emergency medicine that I chose for those particular reasons. It allows us to see people in every community at their worst, unfortunately, and make dramatic changes for many of them in their course of illness or injury, and just very unique. I just had something happen to me the other day that I hadn't seen before, and I've been doing this since 1989, if you can consider residency, and I think that appeals to me as well.
That's amazing. That's really awesome. And like knowing what you do now, what's the one piece of advice that you wish a healthcare executive had told you as you were mapping out your college and career plans?
Well, I think a healthcare executive might have a different question or something they would have said to me. I think those of us who went into it would say, if you're going to go into medicine, especially at this point in time, it's a challenging field. It's very rewarding, but it's incredibly challenging. And there are many pressures on physicians from outside on practice of medicine now that are difficult. And so if it's not something you find a passion doing, it's not for you. It is that passion that sort of keeps us going when things get pretty tough, when we're there in the middle of a pandemic, which obviously hasn't occurred for us before, but when we're there, it's that passion that keeps us moving forward. So that'd be probably my best advice is if you're going, find that area you really love doing.
From this, I want to segue into, you said being passionate about it's really important to know what you're passionate about and to kind of play a role in supporting and channeling your energies in that direction. And I know that you personally are committed to education and partnerships like this, but why do you think it's important for healthcare executives and organizations like ACEP to support future health professionals like you are doing?
There are those who really just want to go into any practice of medicine to simply do the clinical practice of medicine. And that's fantastic. We need all the good clinicians we can get. But the reality for me is that when you are going to work every day, you will find frustrations in your work. And what is born out of those frustrations is a need for change. And the vehicles for change are often found outside of that clinical day of work. And so for me, the organizations, especially organizations or these sorts of types of activities, do two things for you. The first of all, they allow you to find people with like interests. Within our college, for instance, there's probably 35 committees and a bunch of sections that are interest groups so that people can share their knowledge, network with each other, and grow that passion. But the other piece of that is also advocacy, and that is a clear need for us in medicine, is to be able to help people understand what we do, why we do it, what we need to do it, and how they can help us, whether it's our elected officials or whether it's our communities. That is also the strong role of a specialty society like ACEP is to act as an advocate for both the patients and the people that are practicing in our emergency departments.
That's incredible. That's really good to know. Thank you for that. And moving to our next question, as you may know, HOSA has over 255,000 members across the United States and around the world. What role can our members play in helping ACEP improve the future of emergency medicine?
I think, to me, there are two things. The first in any effort is to understand it. I think the first thing for us in emergency medicine is to understand what we do. And I think in order to do that, you got to go beyond basic levels at times. The challenge of our societies at this point in time, or there's often a quick rush to judgment in many ways about what things are and how they work and what they do, but there's a deeper knowledge that has to occur. And I think the other piece is then to understand its impact on communities. Just as an example, we are in many ways, in many areas, the only consistent and constant level of care. When you get into rural communities and when you get into inner cities, in particular, emergency physicians are the 24/7 healthcare, especially for those who don't have access in many ways. And as such, we need to be able to support that appropriately for those communities. Without them, things happen like are happening now with a lot of our rural hospitals that are closing or our inner city hospitals that are closing. And so I think being able to broadly look beyond sort of your own experiences to those that are shared by others and be somewhat empathetic with what they're doing and where they're doing it and how helps to understand why then you need to advocate. So if emergency departments close in our cities and rural health centers, we know that people don't have the same outcomes. And we know that our inner cities in particular are very challenged with healthcare disparities. And we are often that last wall off of which that bounces. So I think understanding what we do in emergency medicine helps understand how it fits into the broader communities that you work and live in, and how important it is, not only for you personally, but you as you experience your communities.
I think that's an aspect of medicine that sometimes passes over our heads is rural settings and the underdeveloped regions that need medical care and attention. is it's sometimes many times we just look at healthcare as a hospital setting and in an urban setting, and learning to acknowledge and understand different communities is so important. I really appreciate that. Moving on to our next question. As an aspiring doctor, how do I figure out the specialty that I love and want to pursue? Like, I understand healthcare is what I want to do, but as far as picking that specific specialty, I haven't had that awakening yet. What can I do to act on and start working towards that goal that once I determine the specialty that's right for me?
I think there's a few things. The first is to draw on sort of your life experiences. There are many people, for instance, who end up going into a field of medicine because of earlier experiences had outside of medicine, whether they were healthcare experiences or job experiences. Those are the ones that sort of led them to do what they end up doing. Maybe somebody started as a paramedic and they ended up doing emergency medicine because they appreciated the need that the emergency physicians fill. The second is be open. And it sounds very trite, but the reality is if you get into medical school, when you get into medical school, you're going to rotate through a lot of different rotations and get a lot of experiences, and be open to learning from all of them, because you may not think those things you initially didn't want to do, they becomes the things that you do want to do. And then it is also talk to people who are working in those particular areas. I've personally had some great mentors across medicine, but I think going to those mentors and saying, why did you choose what you chose? What do you like about it? What don't you like about it? And then aligning that and with the other things, those passions you feel will help you get into the career that will be the best career for you.
Okay, for sure. And I think that helps me a lot. So I really appreciate your answer to that. I think being open-minded on something like this is super important, because it's something that we'll be spending the rest of our lives, loving and doing. So I look forward to that. With that in mind, I do hope that I can approach, and as my journey on this track continues, while I've defined my reason as to why I want to be a doctor, I think I'm kind of curious and I'm willing to stay open to how I can define what type of doctor. So thank you for that. And this brings us to our last question. This is a question that it kind of relates to what your career path took. So you've worked in emergency medicine, and now you're also working as an executive level in more of the management side of what you want to do, what you're within emergency medicine. So when it comes to an individual who wants to go the route of becoming a doctor, how should their decisions map out if they have any plans to go the route of either hospital administration or management? How do you think that you should connect those dots? I understand passion is one thing to understand, but there's also a certain aspect of the field that I think young students don't really understand. So if hospital management, healthcare administration is something that you're considering, do you have any tips or advice for kind of based on your tracking what you followed?
Yeah, I think there's a lot of, I read a lot of leadership literature as well, and there's a lot of discussion about how people end up what they're doing. But first, to get into administration, you certainly don't need a medical degree. In fact, many of the people persons who run hospitals or have that operating officer, that C-suite role, are not physicians. I personally think more physicians ought to serve in that particular role. In terms of sort of coming at it from my perspective and from how I came at it, I think you sort of feel like you're a leader early on in some ways, but when you get into it, I think the first thing is to express your interest in leadership. Often I find that people don't speak out, and therefore they don't necessarily get that initial expectation that they're going to get that further leadership. And that's the first thing, I think. The second is to then not always wait for the perfect role, but find the opportunities. I started my career working as an assistant director for education in Chicago. And about 6 months in, they asked me to be an assistant director at another hospital. And I took it. And I guess everything's happened from there. And I could go through a whole list of things that have happened, both good and bad along the way. But you have to be open to those particular opportunities, even if you don't think the timing is right. It might just be a committee, or it might be a task force, or it might be a lot of different things. And then I think the third thing beyond that that's very helpful is to get some additional education related to leadership. It could be an MBA, it could be something else. My degree happens to be in healthcare quality and safety. But getting additional education is going to help you in that role and therefore help you continue to succeed. And then those opportunities will come along. And I think if you focus on doing those little things every day to expand that network or expand that knowledge, you will find the opportunities over time.
Thank you so much for that response and this entire interview, Dr. Jakis. It's been a pleasure having the opportunity to talk to you. And on behalf of HOSA's 255,000 members, thank you for your time and a truly fascinating discussion.
All these things are things we are challenged with, but hopefully we'll find new and good ways like this to share our thoughts.
We look forward to continuing our dialogue with you and your colleagues to develop future health professionals in emergency medicine and in the healthcare industry as a whole. To watch this interview again, share it with others, or learn more about the series, upcoming guests, and how you can participate in future interviews, go to hosa.org or any of HOSA's social media channels. Thank you.